Okay. All right, I think we'll get this started. So it does say 7 to 9, but I don't think anybody wants it to be here till 9 o'clock. So we will try and not go right up till 9. But yeah, hello, my name is Ben Lindsay. I am CEO of the charity Power to Fight. We empower communities to end youth violence. And thank you for coming to our launch of our Therapeutic Intervention for Peace tip report. This is something which the team have been working on since January, really, pre-COVID. And we'll go into a little bit of how we went from, you know, the pre-COVID world dealing with this, what was a project really before a report, a pilot before the report, into what you've now hopefully downloaded. First of all, I want to just say some thank yous before we crack in. I want to first of all just thank the incredible team, which you can see to the right of your screen. These guys have been absolutely incredible. They will introduce themselves in a moment, but I just want to just big them up and just say thank you so much for your time, your energy, your dedication. There wasn't any blood, but there's definitely sweat and tears, and there was a lot of joy as well. And it was great just bringing such a diverse group of disciplines together. And I think that's what makes the report really unique. So I just want to say thank you to you guys. I also want to say thank you to Lib Peck, Director of the Violence Reduction Unit for London, and the VRU for giving us the opportunity to write this report and the flexibility there. And I also want to thank, and there might be some people actually who are on this Zoom call tonight who actually participated in the making of the report. And that may well be young people, that could be families or practitioners. And I want to thank you. You're the guys who made the report, your open and honest observations. So thank you so much. So just some housekeeping. There will be an opportunity for Q&A. So as we go along, there is a Q&A option. You can just put any information or any questions you've got in the Q&A, and we'll do our best to answer your questions. So that's just one thing. If you are into hashtags and all that social media stuff, all you need to do is hashtag tip report, and you know, let's get trending for the right reasons. So that'd be good. And yeah, I'm just gonna also just say, I have to say it really, if there is any just rudeness or anything which is disrespectful, I will just delete you from this Zoom conversation. But because most of you probably understand safeguarding and want to keep their jobs, because you've all just told me where you work, I don't anticipate there's going to be any issues, but let's just try and keep it respectful. I don't mind passion, but let's keep it respectful. Anything else I want to say really before we get into it? Okay, no, well, I think what I'm going to do then, what I want to do is just hand over to Lib Peck, who I just wanted to she's just going to just share just her thoughts on the report, and then we'll get into the presentation. And just to give you a little bit of a signposting, what we're going to do, you'll hear from everybody involved in different ways. We're going to look at the methodology, we're going to just look at our experiences, why this report is really important, and yeah, hopefully encourage you to take this into your particular field of expertise. So I'm going to hand over to Lib. Lib, can you unmute yourself, or do you need me to do it?
I think I've done that.
Perfect. Okay.
Is that okay, Ben? Can you hear me?
I can hear you.
Excellent.
I can see you as well. Go for it.
Fantastic. Okay, good. All right. Well, thank you very much indeed for asking me to come along this evening. It's been a real pleasure to be involved, albeit in a kind of financial sense, with this report, and it's great to see it come to fruition. As Ben said, I'm the director of the London Violence Reduction Unit, and that has two key aims. One is obviously to reduce violence, and the other is to increase feelings of safety. But I think at the absolute heart of it is that we know we can't succeed in either if we haven't got communities and young people at the heart of any solutions and all of our work. And in the 18 months, give or take a couple of months since we've been set up, we've gone out and spoken to a lot of community groups, a lot of young people. We benefit from the wisdom of both Ben and Ebby on our partnership reference group, which steers the work of the Violence Reduction Unit. And there was a fairly consistent message coming back to us, which is that after a terrible tragedy, after an incident, there is a build-up of trauma that is actually not, there is no means, or there isn't the appropriate means to support those individuals, those communities, those family members in the most appropriate way. And that may have been because the wrong people were delivering it. It may be because it's too far from the community that were most affected. It may have been because it didn't follow the patterns of grief and the patterns of trauma that came up. It may be because it wasn't actually getting out to the right people. And what we very quickly knew from all of that really was that there was an issue here that we wanted to be able to reveal itself much more. And I hope that the report, and in fact having read the report, I know the report does that in an incredibly important way. And so as a violence reduction unit, we haven't then got the resources to suddenly say this is a whole new way in which we're going to roll out therapeutic services. We haven't got the power or the oversight to be able to make the system respond in the way we might necessarily want it to. But what we absolutely have got is both the determination and also some of the levers of influence within our grasp, because we've got obviously the mayor at the top of the violence reduction unit to really advocate for some of the changes that this report I think articulates very, very powerfully. We're interested in systems change. We know there's a gap that's very, very clear from the report. And really I think it's our collective responsibility, and certainly we take it as a responsibility as the Violence Reduction Unit, to be arguing very passionately for a much better therapeutic support service for communities most adversely affected by violence, and want to be continuing working with you. So I'd just like to finish with that and commend, as Ben started with, the authors of the report, because it was great to see it realised even in very, very difficult times. I know each of you have brought a huge amount to it, and thank you to anybody who's on this session who also contributed to it. I think it's a very valuable piece of work and something we'll certainly be advocating passionately for seeing its recommendations realised.
Thank you so much, Nib. Thank you. We'll get into the methodology in a moment, but there's a couple of things I just would like to say. So as I alluded to, and it says in the report, we were initially funded to deliver a pilot service, a therapeutic intervention for peace. We're calling it TIP, which was a lot more culturally competent to impact and work with a small cohort of young people, families and practitioners. Then this thing called COVID happened, and we were like, oh wow, okay, what do we do with this? And very quickly we came to the conclusion as a team, and with the input from the VRU, that would be a great idea to try and turn this into a research report. If we couldn't actually deliver the pilot, could we actually still engage with our client groups, I suppose, and actually get to a point where we can get some really great info and research around therapeutic services, but particularly how does it impact inner cities, how does it impact London, and with a very kind of lens on cultural competency, which we'll go into a little bit later about what does that actually mean. So what you have actually seen, this is why I want to commend these guys, is that while we were all going through COVID, and we were all, you know, some of these guys, in fact, only one member of the team who you can see works part-time for Powder Fight, but everybody else had full-time jobs. We were able to get this incredible research out in very difficult times. There was professional and personal battles, which I'm sure we can all relate to, yet we're in this position to get this report out to you, and I'm very, very thankful for this team. So that gives you a little bit of an overview, and we'll get into a little bit more detail. As you can see, these are the speakers. So I'm just going to ask them just to introduce themselves and just talk a little bit about their journey. Actually, no, let's not do that. Let's just do introductions, and then we'll get into that, because that will take up the 2 hours, I'm sure. So first, let's go to Dr. Zayana Ramadan. Let's hear from you. Who are you?
Who am I? Thanks, Ben. Welcome. Hi, everyone. So my name is Zayana Ramadan, and I am a clinical psychologist. And for Power the Fight, I'm the clinical lead, and I have been for about the past 9 months. I think, as Ben was saying, we were kind of going down a different route with TIP and then had to change everything. And yeah, the team have been amazing. So even though there's definitely been challenges along the way, I think we're all super proud of what we've achieved and what's come out with the report. And I think some of what I did was working with the families and carers and friends. And yeah, just to say thank you so much if anybody is listening that did participate. We're incredibly grateful. And I also, so I work part-time for Power the Fight and part-time in a national and specialist CAM service at the Maudsley. So I'm sort of part NHS and part here.
Thank you.
I could go on, but I'll stop now.
That's fine. Thank you very much, Dr. Z?
Dr. Z, yeah, that's fine. Dr. Zayana,
we'll
just
Zayana. I'm just going to go in order of like what I can see on the screen. So let's go to another doctor, Dr. Elaine Williams, who was our lead researcher and wrote the bulk of the report. So Elaine.
Hi, the test to see if the mic works now. Yay. Yeah, my name's Elaine Williams. I was lead researcher on the project. I teach full-time at Greenwich University. I'm a lecturer in criminology there. Prior to my academic career, I was a youth worker and practicing in crime prevention in South East London. So I sort of come at this from a practice and research background.
Fantastic. Thank you very much. And then Ebenita, would you like to introduce yourself?
My name is Ebenita Iyere. I'm the founder of Milk and Honey Bees, which is a Black girl-led expressive safe space. I'm also a therapeutic youth practitioner at Divert Youth, working with 10 to 17-year-olds who come in contact with police custody. And I was the assistant researcher on this project, which I really loved because it was my first time being able to be part of a research report that my name is on the front cover of, which was very important to me. So thank you. I enjoyed working with this team a lot because not only did I learn, but I was able to be listened to. So my role in all the roles that many roles that I have is working to understand young people and kind of translate and support young people's translation of their voices into spaces that they may not come into. And then also translating what the system may have to say about young people and the issues that they go through back to young people. So this project was very important to me.
Thank you very much. And you are very important to us. So thank you very much for everything you brought to the table. Last but not least, Claude, would you like to introduce yourself to the world?
Hi, everyone. Thanks for coming through. My name is Claude Murray, integrated counsellor. Outside of the therapy room, I'm a chief safeguarding officer and program mentor and manager for a charity, at a charity called XLP. My role within this, I guess, fantastic project was assistant research. So worked really closely with Ebby. And yeah, I would say did the bulk of, large bulk of interviewing the practitioners. That was my role, which was really good and great to hear their insights.
Thank you so much. So as you can see, we basically brought the Avengers together, and you can decide who's who. But yeah, for me, it was really important to just bring people who I've worked with in the past or admired from afar and been like, you know what you guys can bring to the table. I also need to big up somebody who you can't see, Lisa Harrison, who is my project manager for Powder Fight, and basically is my number 2, who was the backbone of everything we were doing. And you can't see her, but she is amazing, and what she's done is fantastic. The other thing I want to just let you know is that we do have a live illustrator as we're speaking, a guy called Josh. And he's actually, if you can see on your screen, depending on how you've got your gallery, you can see that he is already scribbling. And by the end of tonight's session, he will produce something which will look incredible just from all our views and ideas and disciplines. And I'm really excited just to see what Josh is going to do. So we just thought that'd be something a little bit different, a little bit interesting. And we're very much about aesthetics. We're not just about symbolism, we're all about the substance, but we're also about making sure that whether you believe in different learning styles or not, but we just want to make sure that we can try and capture as much as we can. Okay, I'm going to show a quick film, which some of you hopefully might have seen today, but this will just give us an idea, really set in place what this is about and what the project was about, and then we'll hear from our panel members.
This film is a summary of Power the Fight's research into the effectiveness of therapeutic responses to violence in London, which involved 102 young people, 26 practitioners, and 5 families.
In 2019, the number of knife offences in England and Wales was the highest on record, and the number of teenagers stabbed to death hit an 11-year high. When an incident of serious violence happens in my neighbourhood, me and my friends struggle to know where to go for support. The TIP report found the most common feeling in response to violence was anger. 70% of young people felt this way, and 29% said they would want or feel forced to do something back. But there are lots of things making it hard for us to speak to adults. We feel judged and uncomfortable speaking to people who don't understand our culture or day-to-day life. We're worried we might get in trouble. We don't know who we can trust. Lots of us have had bad experiences with authority in the past, like teachers, police, or the courts. Despite what the media might show you, youth violence is not just a black issue. However, black and brown families in the UK are twice as likely to be living in poverty than white families, and twice as likely to live in deprived areas where the risk of violence is higher. We are more likely to be affected by violence, but less likely to meet therapeutic professionals that look like us or share our cultural background. This creates further barriers to therapy and support. Even when we do want to talk, there are long waiting lists. Without help, the unresolved trauma and anger is likely to cause further violence in our communities.
As parents or carers who have lost their child to violence, we also struggle to receive the right therapeutic support. The need at such a time as this is critical, but our day-to-day routine and the added stress surrounding the loss of a child together make it very difficult for us to engage with any therapeutic services on offer. Whether it's funeral arrangements, criminal proceedings, trying to hold down my job, financial pressures, family arguments, many of the services on offer don't appreciate our context. Help that is offered is often only for a short time, and not when we need it the most.
As a professional working with young people and families in the aftermath of an incident of violence, I'm rarely supported or equipped to deal with the emotional fallout in the community. There is a lack of clinical supervision to process the impact on me as a practitioner and as an individual. My experience and knowledge of the people I work with are often ignored, and I'm left feeling frustrated, excluded, and exhausted. This leads to stress, burnout, and a cycle of trauma in our communities.
But what if there was another way to deliver therapeutic services in the context of serious youth violence? Cultural competency is the awareness, knowledge, and ability to understand people and their needs through individual and group contexts, such as race, class, and gender.
The TIP report found that cultural competency training and increased diversity of professional representation was needed at all levels of service systems. Practitioners need access to clinical supervision to support them in their important work. Culturally competent organisations with trusted relationships in communities are best positioned to work in partnerships with schools, councils, mental health, and youth offending services to connect people to the right support.
We need to provide long-term innovative approaches that value informal therapeutic relationships as well as clinical therapy. These include community groups and peer-to-peer support for whole families. We need to provide gender-specific projects that recognize the unique pressures and expectations of women and girls affected by trauma.
We need to address inequality, institutional racism, and harmful power dynamics at all levels, so no one is left behind or excluded. We should be able to access therapy that speaks into our cultural context when we need it, for as long as we need it. This will help us and our communities to become more resilient and to heal from the traumatic effects of violence. The full report provides evidence and detailed recommendations on how to achieve therapeutic interventions for peace. You can read the report online at powerthefight.org.uk.
So that gives you a bit of an overview of the report. Before I hand over to Elaine, I just feel like it's worth sharing a little bit of my journey. So I've been working with young people and families for almost 20 years. And what I think this report has shown is a lot of my experience, whether it's as a practitioner, where as you would have seen in that film, there were moments when I was working for the youth offending service or community safety teams when unfortunately we lost a young person to violence. The clinical support, the therapeutic support, the care just wasn't there. And I remember particular times, particularly around 2007, 2008, where as a team, we'd go to one another to try and support one another, but there wasn't the clinical support there. And then just one of the reasons why we launched Power to Fight is because we had, unfortunately, some murders in Southeast London. And working with those families, we realized that actually the therapeutic support also wasn't there or was not easily accessible for some of the families that we were engaging with. And so you can see that from a practitioner perspective, and you can see that from a family perspective, but also young people. We often say that young people need to support, but these barriers, which we'll come on to in a moment, I often saw on a regular basis. So it's been a bit of a live stream to bring people together, to do some research, to really look at how we can make therapy more accessible, and really look at the context and look at the culture of the type of people we are trying to help and support, and not ignore that. So that just gives you a little bit of an overview of why this is something very important to me. And I think doesn't matter what discipline you're in, whether you're in a youth offending service or you're a faith group leader or in a faith group, this idea of the type of care and pastoral care and therapeutic care for your staff and for the people you're serving is so important. So with that said, I'm going to hand over to Dr. Elaine Williams to just talk a little bit about the methodology and how we got to this point. And I will probably just bring in different people. And in fact, you know, none of you guys are shy as the panel members. So if you do feel like you want to say something, just jump in. But yeah, Elaine, over to you. Just break it down for us.
Yeah, I'll try and keep my methodology brief, but it is a slippery slope when you ask a researcher about their methodology.
I'll just delete you, if anything.
Don't block me, okay?
Okay.
So yeah, once we'd kind of switched to this research project idea from our original pilot idea, we came up with this very simple, straightforward research question, which was, how effective are the current therapeutic responses to violence that we see happening in London right now? What limitations are there, and how could they be improved? So it was a very kind of straightforward look at considering what's the current state of play? What's it looking like now? And then we can figure out where it can be improved. And as a team, we sat down and we said, well, there's 3 target sample groups that we really need to speak to in order to answer these questions. The first is obviously young people. All of the practitioners on the team have in some way worked with young people, so it was very important to us that their kind of experiences and perspectives were included. However, due to COVID, that was probably the hardest cut for us, was that we couldn't do face-to-face research with young people, and we felt that it would be too unsafe to talk about these very sensitive issues over video calls or phones with young people. So we made the decision that this sample group the data would be collected through an online survey. And we had a short space of time, but we got it out there, and I think we did a much more targeted approach. We used our networks of young people that we knew so that we could be careful with making sure we had aftercare plan for them if they needed it. And so I think, you know, we had the sample of 102 young people, which was fantastic given the short space of time that we were collecting data. But we do have to be careful in the report. I would just give a provider that that's not a huge amount of young people. So the data from the young people is really there to reflect on the much more in-depth data that we got from the interviews, just to see if there is that kind of continuity between the issues. But we don't want to be don't want to draw too much conclusions from the data from the young people alone, but we want to see that in perspective with the other 2 groups. The second group that we wanted to talk to was families, and this was, again, very sensitive subject. So we chose to use a very small sample of 5 families to conduct in-depth interviews with, that we could then follow that with aftercare if needed. And we found that was a very ample sample for the really fantastic contributions that we got from our family members who'd lost family members to violence. And the third sample group is our practitioners. So This was a much larger sample. We did 14 interviews, 14 very in-depth, very open-ended interviews with our practitioners, and our practitioners ranged from teachers, therapists, youth intervention workers, custody workers, and frontline youth workers. So we got a huge range of experience. We were talking to practitioners who'd been doing this for up to 20, 25 years. So just so much wealth of knowledge, and we're really grateful for that. We also did 12 questionnaires that we emailed out to practitioners who also responded, and their comments are included in that. So we had this huge amount of data in quite a short space of time. We gathered all of this data, and then the job was, you know, how do we present this in a way that's easily accessible to everyone? And I have to say, you know, credit to the team. We did some amazing analysis, thematic analysis of a large amount of transcript data. And actually, I would say the themes became quite clear quite quickly. I was kind of startled by the consistency of issues that were being raised. I don't think it was difficult to see what the main points were going to be coming out of the interviews, and then comparing that with the data from the young people and the families. I think it's given us a very strong evidence base to the points that we make in this report and the recommendations. If that's enough on methods, I'll move on to the key findings, or if anybody else wants to comment on that.
Before we go into the key findings, I think it'd be really helpful just to hear from some of the teams, just like their experience in actually the interviews. And also I'm going to bring Zayana in, because I think from, I won't speak on her behalf, but definitely from my perspective, we didn't start the year thinking we were going to do a research project. We were very clear that we were going to try and develop a model. So Zayana, do you want to just talk a little bit about the idea of what we were talking about for, feels like maybe a year, of what we felt needed to happen, and how we could just change how families, young people impacted by violence, how we were going to try and bring something a little bit different to the table. Do you want to just talk a little bit about that?
Yeah. I think, as you say, we'd planned for quite a long time about how we might deliver a kind of different model of therapy. And that was very much thinking about how we reach young people and families, how we kind of engage with communities, looking at the fact there's a really large gap within who accesses services and who doesn't, who services are targeted towards and who they're not. And I think within the NHS, I think there's some really fantastic services available for young people, but it just depends on whether you'll engage with people, whether you feel this is the right therapy for you, if you even know what therapy is, would it be for you? And I think there's a lot we've talked about as a team in terms of language, and how young people in particular may think about mental health, for example, may think about what their friends or peers could consider if they went to see somebody, and who is that somebody? And I think one of the key issues that we talked about is who is represented within professional services. And within clinical psychology, it's very predominantly white middle-class women. And that can be a real barrier in terms of if you feel people don't understand your cultural background, where you're coming from, that you have such a different experience from them. And I'm not in any means saying that you can't connect with people, but it's just, it is a particular experience to be in a minority group and have to speak to somebody who may represent other things for you. If they've come into different experiences within services, for example, if you're in social care, if you've been involved with the police, I think quite often there's a mismatch in terms of how people are related to. And quite often when there's been really difficult traumatic situations, young people aren't looked at as needing support. It might be, in my experience, it's been sometimes from CAM services, you might know that there's very sadly been a death, but I'm not sure that young people who have been surrounded by that young person are being looked after. So it might be, are you at risk of offending? Are you at risk of, you know, kind of getting involved in that way? But actually, traumatized youth and traumatized young people weren't being looked after, in my experience. I can't speak for everybody, and I think there's a real sense of, we wanted to make a difference in that way, and we were thinking very much about a conduit model, and how, so as a psychologist, I think there's lots of people that wouldn't want to come to me, wouldn't want to talk to me, but if Ebby introduced them to me and said, okay, this is someone you can talk to, this is someone that will listen and understand, there's a real difference in terms of who we might engage with. So we're very much thinking about having a youth worker connecting a kind of a therapeutic service. So possibly if people did need more specific therapeutic care, we could link them in that way, but just to start with, offering people a space to think about what they might have experienced. Lots of young people don't know what trauma is, or that actually what they've experienced is incredibly traumatic, and all those additional traumas add to how they might respond in a situation, why they might be so angry, why they might want to retaliate. And that's when we also were thinking about families who are trying to manage young people in that way, trying to understand, but also families who very sadly have lost young people who aren't being supported. And that's very much a sense of people wanting support but not knowing how to get it, or if it's really for them. And sometimes, very sadly, from our interviews, being ignored and not looked after by services.
It's really helpful, and I think we'll come on to the model which kind of came out of the findings. But even before that, it's almost like we had an idea, but in a way we needed to prove it. But yeah, that conduit model, you know, how do you connect? How do you have a trusted person almost in the middle, the almost like a broker, the middleman or middle person?
Middle person,
middle person, where we can say actually that's a trusted person who can then be part of that solution. So I just want to bring like Ebby and Claude into this conversation, because before we go on to the key findings, just tell us a little bit about your experience on the project, but also interviewing and gathering some of this information. What was the kind of the general feel for you? How did you find it yourself? And but also just in some of the things that when you were interviewing people. Let me start with Ebby. How just give us a little bit of your experience.
Obviously, and this is probably going to get said more and more, this is not the model that we started with. So initially I had all these ideas. So my work is rooted in therapeutic creativity and using creativity as an expression for young children. So when this came about, of course, this was perfect for me in terms of my career, in terms of the line of work that I do with Divert Youth and the work that I've done in the community. I think I'm going to start with the therapeutic aspect first. I think it was important for us to have this as part of it, because a lot of young people that I work with do not access the services that are there for them, which is why the training that I did was very unique to the way in which I work. I think when it got changed into surveys and doing a research project, of course, I was going to be very reluctant and I did challenge, because I was like, surveys and what's next? You know, what support are we going to do? We're opening a can of worms through surveys. What are we going to do next? But obviously being supported by the team and coming to understand that it wasn't just like some research projects where we're just going to do surveys and leave the young people, I was a bit more confident. So in the interviewing process, I would say at first it was difficult, because I was interviewing young people who I was aware of their experiences. I was right there with them at the time that they was going through some of these experiences. So I felt like they were reliving these experiences virtually with me, but not in the presence of me, which again was very difficult. But through adapting, I guess I was able to learn about how young people express themselves and the need for us to not just be culturally competent, but also competent with the times in terms of like having a virtual reality. And what did that mean for the young people that I was interviewing, not being with me, being able to, I don't know, draw or use form of creativity, but having to talk about these experiences. And, you know, Zanaya, she knows how I feel about, you know, talking therapies and all of this, and we're not going to get into that. But I will say that this experience opened a lot for me into how I can adapt my work into implementing some of the ways in which we asked the questions. And I would say the questions that we asked were very safe, that I was even confident to let some young people even fill out the forms themselves, which just shows how when you do work together and hold young people in mind and even go back and forth and ask young people, even if you're just consulting them off the record. So my role was kind of like a bridge between this report and young people. So what I would do sometimes is kind of take some of our conversations to some young people and be like, you know, I'm doing this thing, like, what do you think of it? And some would be like, oh, nah, man, it's not it. And some would be like, do you know what? I'm intrigued because I know that I need this. And so it was also about allowing young people who have faced trauma to be like, do you know what? I'm ready to have this. This is needed. Why wasn't this here, basically?
And that's really helpful. And there's just a few things which I think, I mean, everything you just said there is gold, but I think it's important we didn't ever want to do a research project and then not model clinical supervision or therapy in our own team, and definitely not with the people that we were working with. So as Ziana introduced herself at the start, she's a clinical lead for Power to Fight. She mentioned earlier on very much about the typical white middle class people you might see. You will see that she's not white middle class. So for us, it was very important to have a very diverse team. But what that meant was that actually everybody who was working on this project had the opportunity to spend time with Ziana. And I think that was really important. So that's number one. And I think the other thing which we tried to model was that also offer aftercare for anyone we actually interviewed if they needed it. So I think, again, we could write a whole report on the importance of that when you're doing research, but that's really helpful. Claude, I'm going to bring you in. And just to say, like, Claude really did a lot of the in-depth interviews with practitioners in particular, and just, man, it was like a warrior. Half the time we couldn't keep up. It was like Claude was just banging this stuff out, and it was just incredible. But just tell us a little bit about your experience in gaining and getting this information, a lot of this qualitative stuff.
Yeah, great, thanks, man. Yeah, as the guy said, we had to be extremely flexible, adaptable, like many people in the chat, you know, during these times. And with the initial plan going out the window, it was like, how are we able to still do something that is quality, that showcases that it can have a really positive impact and effect in the community and sector that we're in. I think for me, one of the things that really shone through was there are some amazing practitioners, professionals, workers who are on the front line, who are working their socks off to ensure that change is happening, to ensure that lives are being impacted. And they're not driven by like large sums of, money, but just that care and support that they want to be able to provide. And every practitioner and professional that I interviewed, that came through. So if you are in the chat, if you are on online, we just want to say we thank you, because the work that you're doing is immense, and we know that many times you're overlooked, but we see you. We just want to recognize you for that. I think, as you can see, there's a crazy fly flying around. But yeah, I think for myself, like within doing the interviews, what really came through was that the practitioners that were on the ground working many times were, working in, I guess, environments and with young people where trauma was so prevalent, was so present. And, the practitioners are encouraged by, their organizations or their management to build meaningful, purposeful relationships, but many times at the cost of maybe their own well-being, and that structure and that wraparound support, that clinical support not being put in place. So as much as it was a great privilege to hear some of these great stories of, fantastic work that was being done, and that filled me with hope, on the other side of the spectrum, the other end, at times it left me quite sad and, feeling it for, I guess, my fellow practitioners across the board on the front line working with young people, and people maybe citing that, they felt, really exhausted, and they were almost living for the weekend, and the weekend was almost their pit stop to be able to try and to just, find some respite and some time for themselves. And so that really came through, just the importance of us as a sector, or the different disciplines that we're in, that clinical supervision is so vital. And we noticed, and what came through is that the work that they would put in place to be able to even try to get a young person to make that step for the therapeutic door, the amount of work that would take place to even try and get that person a first session, often going, the extra mile, having to use different kind of like, techniques, to try and engage and to get that young person to even to the point of I'm going to partake in, you know, at least my first counseling session. I'm going to try and give it, you know, at least one shot. And then sometimes to be met with a massive waiting list, or to be met with someone that they just felt they couldn't connect with. And that really rang through like the research, and just really highlighted that it's so important that we coined the phrase, the invisible conduit. That's what we coined. The invisible conduit is the person in between the therapeutic room and the service. So you meet that young person. So it's almost like everyone in that chain needs support. Yeah, so I think hopefully the report has highlighted the importance of that.
That's really helpful, and thank you. We've obviously spoken about the young people we've engaged with. We've spoken about the practitioners. I just want to bring Zayana in very quickly, because she was the one who was doing the interviews, and I think every group of people we were interviewing, it was tricky, but I think when it came to families, knowing that the violence and the death they'd seen and had impacted them was very raw, and therefore it was super helpful to have a clinical psychologist basically doing that in such a compassionate way. So Ziana, very just quickly, what was just some of your experiences interviewing those 5 families?
I think just firstly to say, I was so struck by their strength. Each person that I spoke to, it was always from a kind of hopeful position, even though they'd been through the most traumatic and difficult thing that they could have ever imagined. And the fact they took their time to speak to me so honestly. And I think the difficulty was, obviously we were supposed to meet in person, and we're doing it in a Zoom chat, and you're talking to someone about something that is, you know, imaginative in terms of the pain and the grief and trauma, and just being so careful to not evoke that again in people, and just really gently kind of having a conversation that's really meaningful, but not in any way pushing somebody into a place where they didn't feel they could cope. And I think one of the things that really struck me was just the level of distress that people have been through, and they were not looked after. And I think, as Claude was saying, sometimes, you know, you feel a sadness about what someone's been through or what you're hearing them say, but also that everybody, they relied on themselves. They looked to themselves to support family members, to support partners, to kind of look after their communities, other young men. I think something that really stood out for me was one of the mums just saying that her son had very sadly been killed, but none of his friends were looked after. None of the other young people were offered support. They were, you know, they engaged with the police, and she worked really hard to get them to you know, go to court and be supported. And I think the court situation in particular is something that came up repeatedly, as well as being so traumatic and difficult, and just people didn't feel looked after. And I think you're going into a situation, and I think the police tried really hard to kind of explain what it might be like. And I think they've, you know, different people I interviewed kind of had different flashpoints, if you like, that were incredibly difficult for them. But one of them was just not having someone to speak to, and having to reach out for support themselves, not having people come and say, we're going to look after you, what do you need? People having to organise funerals without enough money, people having to move house. The effect of the media was incredibly powerful and quite detrimental to people who had to try and say, my son wasn't in a gang, this was a violent attack that he suffered, he did, and having to justify that their family member was a good, decent person, and that having to be one of the first things they did when they just lost someone so close to them. So I think it was, there were so many different themes that came out, and one particular interview, it was just too painful to continue, so we stopped, and we were always really, really careful to make sure that everyone was looked after, whether it was the young people, as Ebby was saying, or whether it was practitioners, as Claude was saying. I think the families did require some follow-up, and I think they were really hopeful that this would make a difference. And I think that's what I wanted to hang on to, that idea that they really felt they were doing something that mattered, and that talking about their loss and their grief and their trauma was for a meaningful purpose. And so just to thank everybody for what they, you know, it was a difficult conversation. And I think, as you were saying, Bennett, obviously it's helpful with my background, but even being a psychologist, you feel someone's pain, and you feel what they've been through, and just to recognise that there was so much strength and grace within that. So just yeah.
Really helpful. Thank you so much for like everything you three have just said. Okay, we're going to move on to the actual key recommendations, which so I'm going to hand over to Elaine here. Now, what you've just seen is a big block of writing, and Elaine is going to hopefully break this down a little bit into some parts. But these are the key findings which we found, and a lot of this stuff is kind of what you've just heard from Zayana, from Ebby, from Claude. But I'm going to hand over to Elaine now just to talk us through some of this stuff. And just to say, any questions, and there's some stuff which have come up in the chat, which is really helpful, just people's experiences and people agreeing with our panelists. But if you've got any questions as you go through this, and as we go through, we'll go through this, and we'll go through the recommendations and the models quite quickly. I'll let Elaine, and we'll have a bit of time for Q&A if you've got anything. So over to you, Elaine.
Thank you, Ben. Just listening to everyone talk there, before I introduce the findings, I'm struck by, reflecting on research practice is interesting, because I think the same barriers that we talk about in therapy exist across all institutions, and research itself can be restricted by who's doing the research. And I don't think we would have got this data, we wouldn't have got the quality of the richness of the data that was available for the analysis, just wouldn't have been possible if it wasn't for these guys and the amazing interviews they did. And Ebby calling people to talk them through the survey, that enabled us to have young people who would normally never want to log into an online survey and do an online, there's young people who contributed this report who would never have done that if it wasn't for the support that members of the team gave. So I think when we go through these findings, I think, and when you go through the report, actually, you can see that as much as possible, the participants speak for themselves. We used a lot of quotes. We used a lot of quite large quotes, which is sometimes unusual in report writing, but we wanted those practitioners to be, and those participants to be represented as their voices were heard. So I think there's a huge amount of just what people said, their voices being represented. So I will talk through the main findings, breaking them down by the sample group. So if we talk about the young people first, and this is not just what the young people said in the survey, but what practitioners said about young people and their experiences with young people, really the biggest findings relate to this proximity and normalization of violence in their everyday lives. And by this we mean not just physical violence, which we're all kind of we hear a lot about, but this kind of childhood trauma, childhood violence, exploitation, neglect, and these other forms of violence like structural violence, symbolic violence. So this idea that children are, that one part of their lives is this kind of risk of physical harm that's very present in their everyday lives. But the much bigger picture is to think about structural violence as economic deprivation, and extreme marginalization. So we're not just talking about, not being in education. These are extremely marginalized young people who are facing systemic exclusion based on race, class, and gender as well. So we wanted to, the findings really present this much more holistic landscape of harm and violence that young people are experiencing in their daily lives. Now, when it comes to thinking what the findings mean in terms of how can a therapeutic response be effective, what we see then is no wonder when a young person who has experienced all of these dimensions of marginalization, it's no wonder that when they step in a room with a very, a formal, professional-looking clinical psychologist or therapeutic setting, that is not going to be something that they will easily engage with, that would be accessible for them. So when we look at this broader picture, then it begins to make sense. Of course, this isn't going to work. And of course, we're going to get that idea of, if the service isn't working for them, that's a further marginalization. We're saying, you're not welcome in these therapeutic spaces either. And that can contribute to that cycle of trauma and exclusion, which perpetuates violence in communities. So those were the kind of key findings around young people. I'll go through all of them, and then people can jump in with comments. So the next group with the families, and again, as Zayana pointed out, it was so important for families to meet with other families, or to meet with practitioners who shared similar backgrounds, who they could relate to, or or feel mirrored in the room, as a lot of participants spoke to. So we saw this kind of very obvious lack with the families. It was very clear that there just isn't sufficient support for families who've lost loved ones through violence. And what we can see, particularly from the women, we see this very a very pressurized environment in the aftermath of loss, where they are trying to hold everybody together, trying to hold their families together, trying to hold it together for their younger children or for siblings of the lost one. And amongst that, they're given 6 to 8 weeks of a stranger you've just met. This is your chance, this is your free therapeutic service, and then it's over, it's finished. A lot of the time that was finished before they went to court, so the court case was hugely traumatic, and they received no statutory support throughout that process. So it was very clear, very consistent throughout all the interviews with the families, that this was that we're not supporting, particularly women who cannot, just don't have the capacity in that immediate aftermath to get the support that they need. And so that's something that comes up in the recommendations. Finally, the practitioners. So the key finding for the practitioners is that we need greater representation. It is one key recommendation that we found time and time again, that practitioners with lived experience or community knowledge were being almost exploited for their ability to connect with young people and to do the work that very few people can do. But that work was just not being valued, not financially in terms of being supported in the career, but also not being supervised with clinical supervision after carrying this weight of responsibility for the families that they worked with. But then that same experience, that same kind of knowledge of young people and their families was acting to exclude them from those senior management roles. So they were often the only person, they would be the only person on the team from the local area in the senior management strategy meeting. Their voices were not heard, their opinions were not being enacted, and so there was a sort of double betrayal almost, that the practitioners consistently expressed this feeling of their work not being valued, whilst it props up these systems and services, and meanwhile they're not being allowed to be on the strategy meeting. So one key finding is just this: we need representation. We need equal representation from all backgrounds across the board, all the way up to senior management and leadership roles. Yes, and finally, I just wanted to comment that we talked a lot about the referral systems themselves, and we found that invariably they were not joined up, they were not flexible. They would tell young people, it's you either don't qualify because you're not at risk enough, or if you don't engage on 2 visits, you're off. This kind of very strict system of either you want the service or you don't. And practitioners were telling us, I honestly don't want to refer them because I know how bad it will be for them once they get there. So we've got a huge problem in terms of the referral systems not being fit for purpose currently, and that's a key finding from the practitioners.
Really helpful. So we're going to go on to the recommendations, and I'm seeing your questions in the chat. What I would just say, just to make it easy for me, if you've got specific questions for any of us, put them in the Q&A. That would be really helpful. So then, and then we can keep the chat for like observations. But if you've got questions, I've seen a few come up, and I've seen a few people disagreeing in the chat. So yeah, just a few people have basically, let me just go up a minute. So people disagreeing with Claude earlier on. So many organisations don't protect those frontline workers that are vicariously experiencing the trauma that are working within young people and communities all the time. Clinical supervision is essential to give practitioners the robust support to be the best they can be for young people. Yep, and that came out a lot. we've got some reflections. We've got the Bishop of Edmonton in the building. Hello, Rob. I'd really appreciate your reflections on the help, hindrance that priests, clergy, pastors and church communities are in these moments of trauma. Yeah, I'll come on to that. I'll have a look at, we can have a bit of a conversation about that a bit later. And yeah, a clear example of the power of trusted relationships, conduit model that you raise in the research being used to inform the creation of research. You know, it's really good. So, okay, we're gonna go on to recommendations. Unless there's anybody on the panel who's desperate to make a comment on what Elaine has said, or we can talk a little bit later, or we'll move on to recommendations. Cool. Go for it, Elaine.
So we were all very keen to have quite pragmatic recommendations. I think we've all read lots of reports that have these kind of vague conclusions, and the report is very heavy. It's very harrowing in parts. So we wanted there to be some sort of clear hope, or a way that we can think about doing things better that could actually be implemented and not just be talked about. So first of all, we've had this cultural competency training at all system levels and clinical supervision. So this kind of confronts this problem of people being excluded on a practice level, and clinical supervision for all front-facing practitioners. This comes alongside just value the work that these workers do. These frontline workers are doing an incredible job. Like Claude said, these invisible conduits, like we need to make them visible. We need to support what they're doing so they don't burn out, so they're not having breakdowns. These are the people, these are the skills that are so hard to find and are not valued. And so really the key recommendation is to support those workers and make sure that they are given pathways to management roles. We have this multi-layered intervention idea that, what came up time and time again is that different types of therapy work. And this idea that there's only one model or one style of therapy that fits all is not going to work. So we need to equally value different forms of therapy, both formal and informal, including creative therapies. Some of the success stories that we heard were based on really creative ideas, some wonderful projects around planting, growing things, just going out for a coffee. And I think when we get to the next slides, we'll talk about how that model might look. And this collaborative case mapping is the third one, so that we're looking at ways in which you can come together before a referral is made to understand the whole context of that child or that family's positioning. Who knows this family? Who already has trusted relationships with that family or that young person? Who's worked with them before? What could work? What doesn't work? Have they lived here? Have they lived, we can look at areas, geographic mapping as well as symbolic mapping. So we need this kind of a joint collaborative effort to synchronize all of the services, to bring them together to make the best referral. And that will require some really cohesive and effective partnership work. And one of the things that came out, particularly from talking to teachers, is that many professions do not have the resources or the facilities to manage these relationships, to manage these partnerships. And I think all of the team is very keen to emphasize that we are not expecting youth workers or teachers to start doing extra work on top of their already heavy load to facilitate these partnership roles. And so that kind of brings us on to the model of how would this be, how could this work? So this is the engagement model that we are recommending, that when a service referral is made, and we'll talk about who might make that service referral in a minute, before you meet with the young person, before the families are engaged, it goes through a process of case mapping. So in this model, you would have a meeting with everybody who you can gather in a room, all of the people who are significant in that family or young person's life, and you would talk about best practice, you would talk about the trusted relationships, who could do this work, and then you would think about realistically which forms of therapy are we likely to be able to engage this person or this family with. And I think we need to recognize those informal therapies where particular, when families or young people are extremely marginalized, sometimes just having someone who can phone them and have a conversation on the phone, or a very informal cup of coffee in a coffee shop. Even these very small informal forms of communication and talking therapy are extremely valuable and should be valued equally with other layered responses across the board. So we have creative therapies, formal therapies, which are interchangeable. So, families can move between the two depending on what's going to work for them, or what's best for their situation. And finally, everybody involved in that front-facing delivery receives clinical supervision as statutory requirement. So we don't have practitioners being left to carry all of this emotional labour on their own without fully being supported by either their employee or an external agency who provides that supervision. So if we move on to who then? Who then can make this case mapping happen? And like I mentioned before, we've had over a decade of austerity. A lot of services are stripped right back to their bone. We cannot expect particular services to find the space, money, resources, and employees to make this case mapping happen. So it is our suggestion that there is an external, culturally competent conduit organization who takes on the responsibility for managing that service agreement. And it's very important who that organization is, because as we heard time and time again through the experiences of our participants, if it's the wrong person, if it's the wrong organization, it is not going to work. You're not going to engage those extremely marginalized individuals. So we need to have someone who has connection power in order to link the organizations, to bring those different services together, to produce those case maps, to produce those referrals that are holistic and taking in all of the context into consideration. And we want as many of the services to be involved in this agreement. So if you look down on the left-hand side, schools, local authority, youth offending services, but also local faith groups are as Ben will tell you more about, but faith groups are in unique positions often in terms of space, time, people, trusted relationships, long-term relationships with family and young people. So we need to be quite creative in thinking about all of the different organizations who would be involved in this service agreement. And then that culturally competent organization can deliver two things. On the first instance, they support with the engagement. So they become this broker, this intermediary to make sure that the young person and the family is getting the right therapy that they need. And secondly, they then support those organizations in terms of, are you culturally competent? Is your own house in order in a certain respect? So they can then provide that training, provide that support to improve the services and how they're functioning, to make sure that they are giving young people and families the best opportunity to engage in the services that are available. Wow. Is that clear?
I mean, it's amazing, and I'm sure there's a lot of information. Okay, I mean, it's just incredible, but what hopefully people can see is what we were hoping, the last two slides, what we were hoping to deliver before lockdown came into play. But in a way, it's great that we've been able to be informed in what we want to deliver. So that's really important. I just want to hand it open to the panelists very quickly. Any observations from whether it's the key recommendations, this model, this structure, anything the key findings, any observations which you want to just mention before we open it up for Q&A, really?
I think I'd like to say about the whole aspect of youth work and therapy, where youth work meets therapeutic bridge work. I think it's important to understand that youth workers open wounds and they're not trained how to sew them back up again. I started to reject the term youth work about 4 years ago. I prefer being called a youth practitioner. Reason being, when I started to sit in more higher up meetings as a youth worker, talking about young people, knowing what I'm talking about, I was dismissed based on the fact that I was a youth worker. And I think that with youth work, sometimes managers are gatekeepers of where they can go. Luckily, I'm very blessed to have somebody who does not gatekeep me and pushes me out there to do as much as I can do. But I think it's important to understand that with therapeutic training and youth work, there is a place where it meets in the middle, but it's also very different. And I learned that on my course, that there's so much skills that youth workers possess and that we possess, being able to connect with young people who may be hard to engage, young people who may have experienced trauma, or young people who may not have even had any support in general. But when it then transitions into the therapeutic aspect or working with a therapeutic service, the aspect of cultural competency does take a major part of it. And I think that with cultural competency, we have to acknowledge race, because race is important, but we also have to acknowledge class. And I think what I've seen in the youth sector a lot is people writing funding bids to do this work, but not necessarily being able to do the work because they are not necessarily culturally competent as an organization to be able to reach and support the young people and the families, which means that young people who may really need the support are missed, or families who may have had fragmented relationships with all of these people that are listed on the side are also missed. So I just think that organizations who are looking at this report and want to adapt this report also take into consideration the thing at the top that says connection power, which is where your unconscious bias really needs to come in and be suppressed to be able to allow frontline youth workers and frontline practitioners do the work that they need to do. Now, it's all well and good giving us the skills, but my thing is, with skills comes payment, because we all have bills to pay. And I think it's important to call out the youth sector for when frontline practitioner jobs are put out there, the salary that they're put out there for sometimes is maybe not worth the stress and the real work that we're going to do. Again,
so sorry to cut you. So what we're basically saying is, this term lived experience.
You need to pay us more.
Yeah.
Like, well, not me, because I reject the term, but you need to pay them more. And I say this because I know so many amazing practitioners who I work with, who I follow, who are all over the UK, who all say the same thing. I feel like I'm being exploited in my organization due to the glass ceiling that I've reached. And I always get the same question: how did you manage to overcome that glass ceiling and do the things that you want to do? Well, I asked, and if I'm not listened to, then I resist. Just like how young people resist the systems that have for so long, like, trapped them in. Practitioners as well, like, we need to start also being able to resist the things that box us in and use these kind of models to elevate our work. Because for me, the people on the side, on the left-hand side, without us, they wouldn't be able to do a lot of their work. And I just think it's important to acknowledge that.
So I mean, as you can see in the chat, a lot of people are agreeing with what you're saying. And I think there is something about valuing the workers, and not just valuing them when they're being rolled out for a conference, but valuing them in a way where they are part of the strategic direction of the organization, and valuing them so they feel like they belong, but as you've also said, that they are paid in the correct way. So I think that's a very well articulated point. Any other comments from our panelists before we get into the Q&A, because the questions are coming in and the observations are coming in. So Zayana, you've unmuted yourself. So
I have. Just really quickly, I just want to say that yes, we're coming up with an innovation and an idea of how to have a different model of therapy and engagement, but that doesn't mean we wouldn't refer to other services already in place that are doing the job they should be doing and engaging people. So just to say that if there was complex trauma, for example, that would be something that would be referred to the specific service for that, but we would be helping people to find what they needed, whether with us or whichever service. So just to pop that in. So very much about the network around us as well.
Yeah, absolutely. So I think what we do need to acknowledge here, we are not trying to reinvent the wheel. We're not trying to abolish any services which has already been there. But what we are saying and what we have noted is that there is a clear gap. And I think there is a difference between the complex needs which a lot of these services do and work in, and this kind of need where the threshold is so high that there's actually young people and families who need some type of therapeutic support, but they don't meet the thresholds for CAMHS. And we've all seen some, unfortunately, some situations, or I have anyway, where young people needed support, didn't get it because they didn't meet the threshold, and unfortunately I've got themselves caught up in a complete madness or passed away. So we're saying that actually there just needs to be this middle ground, which is not happening. Okay, anybody else on the panel want to just comment before we move into Q&A? Okay, right, Royal, there's a few questions coming in, and I'm going to try and do my best to, what I'm going to actually do, I'm going to stop the presentation. Hopefully that means I can see the Q&A. I've got them sent to me, so let's stop that, see what happens. Ah, there we go. I can see the questions now. Fantastic. Okay, so I'll between the questions and the observations, I'll try and like mix it all up a little bit. So we've got one from Andre Harriet, CEO of the Liminality Group, a partner of Power to Fight. Good to see you, Andre. Dr. Elaine and Dr. Ramadan. I'm going to, Dr. Ziana, you can call her Dr. Z, but that's cool. You're giving her the full title. How do we increase representation within your specific disciplines? Great question. Let's go to Dr. Z first.
That is a really great question, and I think that's actually something within the NHS they're trying to think about at the moment, within particularly in psychology. And I think some of the things in terms of going back to grassroots, it's going to primary schools, secondary schools, kind of talking to young people about what opportunities there can be, that the doors are open for them. I think lots of people don't even consider that they could, you know, be involved in some of these careers. So it's about being there to show, look, you can do this, and you might have to work hard, but you know, there is an opportunity. I think also offering things like mentor schemes that might be, I think as Evie was saying, you know, in terms of paying people for things, how do we support people in these roles, but in a paid way, and trying to maybe do even things like work shadowing, thinking about how we go into universities as well and support people doing undergraduate degrees to think, okay, where can I go with this? How do I get support for this financially as well as, you know, professionally? Because it's, you know, it's a hard route sometimes to think, right, no one else in my family has done this. No one else in my community is necessarily doing this. How does it fit with me? And it's helping people see that step that it is for them and it does fit with them. But we have to, I think, get out there a lot more and talk to young people and help them think about what their opportunities might be.
Really helpful, really helpful. Elaine?
Yeah, big question, Andre, dropping the big ones. Yeah, I agree with everything Ziana said in terms of, you know, increasing access and starting early with accessibility, but I just think academia is just endemically racist. I'm just going to say it. And there is elitism in every corner. So
Elaine, I'm going to say, break that down, because while I understand what you're saying, when you say academia is racist, just unpack that a little bit so we don't walk away with a blanket generalized view that academia is just racist.
You know, we don't have a lot of time, but you know, so I won't spend too long. But you know, we've had a lot of conversations, and it comes down to this kind of, that first of all, you know, the curriculum, you know, the foundations of academic curriculum favor white theorists, white academic, the white tradition of knowledge. So in terms of its kind of its root, it just, you know, and it becomes very difficult when you're introducing students to theory. You know, you know, how do you decolonize your curriculum to make sure that that you are, you know, challenging the imperialism that exists in just the reading list, right? So we've got this kind of hierarchy of knowledge at its foundation. So, you know, we need to just knock it down and start again. But I think in terms of like pragmatically how we challenge that, you know, we've talked a lot about, you know, if you then challenge those sort of knowledge sources of so, you know, we say academia is the source of knowledge. It's where you go to learn the highest things, you know, the best knowledge. Then who is in that space teaching? You know, who are the gatekeepers to deciding whose knowledge is whose knowledge deserves to be shared at university? So, you know, we need to make sure that you know, black lecturers are being seen, you know, that you know, this isn't a kind of white dominated space culturally and symbolically. So, you know, you need to see it and it needs to be challenged continuously. Black students need to feel comfortable in the classroom. And, you know, we've got the same problems as we talk about in therapy. You know, if they are not feeling like these are safe spaces for them to learn, and we've been hearing time and time again for students that they're not. So how are we expecting them to not only succeed, but, you know, get up to the point where they're allowed to teach? You know, so we've got, it's just, you know, it starts with making sure your classrooms are safe, that you're not got some academic who's going to make bias assumptions or make students feel excluded based on their, not just their race, but all sorts of dynamics of inequality as well. So yeah, it's a big question. I'm here for the discussion, and I'm here, but it's probably not for today.
It's a really good answer, and I think that is a research project.
Yeah, that'll be our next project. Yeah.
So okay, one for Lib, again from Andre. Lib, Peck, how do we legislate for statutory clinical supervision? That's a great question. And another big, I mean, Andre's just hitting with the body bag punches right now. So, Lib, any idea how we make that, Andre?
Well, I mean, I think probably this also answers the question that I think Pippa asked earlier on in the chat, which is what could we bring to this, and you know, as a unit. And what we can bring to it is some promotion. We can keep making the case. We can keep talking about the case. We can bring influence in terms of using the mayor's role to advocate more clearly for it. We can also, I think, bring influence with other key partners. And, you know, I know, you know, through the partnership reference group that I've already talked about, you know, which Ebby and Ben are on, you know, we're going to have a discussion at that next time. And that sounds perhaps very vague, but actually, you know, sitting around that table, you've got kind of key people in the NHS, you've got key people in education, you've got key people in local authorities. And that then begins to do some of that brokering, that begins to do some of that influencing that we're talking about. And I suppose from that, then that's where you start building movements, that's where you start advocating the case, and that's where you start getting into statutory change as well. So I mean, that's the way we could do it. Just to sort of tack on the other end bit of to Pippa's other bit of the question is, I think we could also, you know, everybody's referred to the fact that this ended up in a different format to what it was intended to start from because of the impact of COVID. But you know, we've got some small resource to continue to make case, and if a more, you know, pilot model was something that was of interest, that is something that we could certainly look at. So, you know, we're not going to be able to refund the whole system, but certainly through those kind of, hopefully through that sort of useful way of using the funding we've got, we can continue to do that influence, continue to do that advocacy.
Really helpful. Thank you. There's another question. I'm going to put this one to Claude, if that's okay. How do we move to an approach where, for example, our young Black boys and their families are welcomed rather than just watched, that they will empower themselves to succeed in life? So I suppose we're talking about the flourishing of Black and brown children and families. And just as I think this hopefully comes really clear in the report. This report was done in a London context. No one who wrote this report believes that youth violence or violence that affects young people is a solely Black or brown issue. Nobody is saying that, but we do acknowledge in a London context, this does, knife crime and that type of violence disproportionately impacts Black and brown communities. I think it's important just to put that out there, so we're not making, but I think this is a good question. And Claude, I just wonder whether there's any kind of views. Wisdom.
Yeah, Ben, so sorry, when we're saying watched in terms of by, yeah, I
suppose, I mean, I imagine there's a bit of a, I can't speak for the anonymous attendee, but I imagine there's a bit of a voyeuristic. Sometimes it's like we don't necessarily put all the time and energy and resources into Black families, so we do get sometimes we get like a repeat pattern in some context. Is probably how I would put it. Is there maybe an approach which will, let's put it this way, is there an approach which can help the flourishing of Black boys and their families?
Yeah, I think that starts from early. that starts from nursery, that starts in your primary schools, your secondary schools. And it's almost like, as we've been speaking about the cultural competency training, every establishment being, trained, and having practitioners from a wealth of different backgrounds within these different organizations. And I feel, I don't know if it connects, but for example, when Elaine was talking about academia, for example, I guess being whitewashed. I remember as I was training to become a counsellor, and I had to make a disclosure of something that happened many, many, many years ago. The person on the course asked me, 10 years, 15 years later, are you in a gang? And I'm working, I'm providing for my family, I'm a married man, and I remember I left leaving demoralized. I left feeling stereotyped, stigmatized, and almost, as we talk about the flourishing, I was a black man, no longer a boy. I left feeling crushed, and I can say that didn't prohibit me or prevent me from, becoming a qualified, counselor. So I say all of that to say, across the board, the different establishments, the importance of cultural competency, the right training, and there's just something in terms of the power of identity, the power of teaching, ourselves on who we are, and many organizations sometimes may come across a young person or a black family, and an incident may happen, and the presumptions, there's the criminalized kind of lens that's actually, people are peering and staring through. And I can think of young people that you spoke about earlier on, Ben, that might not meet a CAMS remit, but yet they have to walk past that same murder scene every day. The same memorial site every day just to go to school. So it's like across the board, the different establishments, us being intentional, us putting our hands up and saying, look, we don't have it right. We need to get the right practitioners to come in. I think there's some ownership as well on, the black community as well within that sense, in terms of like, it's across the board. So ultimately, I would say, the establishments, all the systems that are in place, culturally being competent. Yeah.
Really good answer. I think.
Can I just add on to that?
Yeah, go for it.
I think it's also important to look at de-fetishizing the work of working with young black boys.
Yeah.
I think that there's so many systems and services that fetishize over working with black boys who have been through X, Y, and Z. And I think we need to stop that, because the more we do that, the more systems become far further away from cultural competency. Yes. And the thing is, this is where I call it conscious bias. We can label it as unconscious bias to make everybody else feel comfortable. But when we speak about unconscious bias, we're not talking about how unconscious bias plays into fetishization, which then plays into the segregation of black girls. And I just think that when we're looking at systems and services, and the systems and services that work to support young people who have experienced violence or trauma or mental health, they need to look within their organizations and really understand who they are and why they're doing this work. Because like Claude said, a lot of these children are walking past, they're walking past memorial sites every day. And this has become my national anthem, but we still do not have a culturally competent bereavement service that works with these children. Absolutely. So how are you drawing down funds to do violence reduction work, but you're not doing loss and bereavement work? How are you comfortable talking about violence that affects black boys, but you're not looking at their counterparts from a whole family approach? Yes. So my thing is, and I just had to say that because I agree with everything that Claude said, but at the same time, we need to start looking at the structures that support our organizations to work in our community, as well as hold accountable our community for allowing these organizations in.
Yeah, and I think that's
Ben, can I just jump in quickly?
Well, let me just before you jump in, let me just try and bring it all together, because I think there's lots of brilliant points coming in. And I think the voyeurism, the fetishization is something which I think we really do need to address. Because in my experience, what I sometimes find is that a lot of these organizations are set up. They do draw down these funds. They do then are placed in our communities and then can't do the work. And that's got to stop, because what will tend to happen, and maybe I'm alone in this, but I will get a phone call with organizations that have got big money, and then I get the phone call, can you work with us? And I'm like, whoa, there wasn't a consortium bid, there wasn't a partnership bid, but you want me to do the work? Or in some cases, I've had people from organizations actually reach out to me saying, I'm now in a particular hard context, can you help? But it's like, you're picking my brains, and like Ebenita has already said. So I think there's a problem there we really do need to address. So we're talking about structures and systems, and it goes back to value. So I think it's a very important point I just wanted to bring together. Claude, just finish up on this, and then we've got a few more questions to go through.
You kind of hit the nail on the head, but it was just, there's as Ebby was saying, the fetishization of the black case study. You know, we work with this young person, we polished him up.
And then they end up on the front of the annual
report.
The report, or a conversation, like a conference. We've done our bit, and we get all this money in, but we don't even have cultural competent workers to work with this person, and this young person goes back to the very same community with the same challenges, but it looks very glorified, like we've done some amazing work. And I think that's we need to stop that.
All right, I'm going to just try and get through these questions, because they're coming in and some really good questions. So we've got a question from Gina. I'm a mother directly impacted by youth violence. It appears to me that no one recognises our voices. We are not professionals, yet at the forefront when impacted by such trauma, often giving an immense help and support to families and young people. We are often left out of this equation, yet we are strong pillars in this circle. How do we start a movement to include our voices? First of all, Gina, I just want to honour you and say, you know, whatever you've gone through, first of all, I want to just say, you know, I'm sorry, and here's out. Hopefully you can see from this report the time and energy and empathy and compassion that we're trying to bring into this conversation, the nuanced conversation. But I think this is a very, very, very good point. The idea that there are multiple, and Ebby, you speak very articulately on this, that there are multiple women in our communities who are holding the communities together, but don't get the recognition, don't get the care, get often overlooked. So what do we need to do to make this change? How do we make parents, mothers, aunties, sisters like Gina and others more included in the conversation and part of the solution in a more co-designed, co-produced way?
Again, just to echo Ben, Gina, I empathize with you and commend you for being able to put yourself out there like that. I think the first thing that we need to do before anything is make sure that you have the support systems that you need before you can support anybody else. And the reason why I start there is because it's very easy when, as women, especially when we've been through something, to want to go and help, to want to start a movement, to want to put ourselves out there to look after everybody else. But what we find is that while we're doing that, we're burning out because we don't have the correct support. So I would say before you start any movement, just find a support system, whether it's through a faith group or a friend or just someone that's going to be able to support you. In terms of women and this movement, I would say because people view violence as a male-dominated issue, they don't look at the roles and the responsibilities that women play. And it's only when women are exploited by boys, and this is where it goes back to the fetishization. When a girl is exploited, we have so many people that want to rush in and do work, which is understandable. But like people like myself, mothers like Gina, aunties, a lot of the young girls that I support and have supported, we have been traumatized by violence. And so where was our voice? Our voice was only useful when the media come. Our voice was only useful when you needed somebody to bail out this child from the police station. Our voice was, again, only useful when you need somebody to talk about the community, because the black male that you fetishize over, you cannot engage. So I think this is where, this is a call out to yourself, Lib, in understanding the roles and responsibilities that women play, mothers play, aunties, because I've said it time and time again, the roles and responsibilities, girls, women are mobilizing in their communities, and they are not healing from the trauma that they have been impacted by, because we don't have people that understand that, you know, if a black boy dies, this is going to equally affect their girl or woman counterpart. It's not looked at and it's not understood. I think in terms of mothers, I do believe that mothers' voices are so significant in understanding how trauma manifests in the household, because I'm not a mum, so I cannot understand the detrimental effect it has losing the child. But I've held mums that have lost their children, and I know what that countertransference felt like, holding somebody's mum as a professional who's lost their child. Am I Ebby the professional, or am I Ebby whose dad was the daughter of somebody whose dad was just in here? That's where the thin line for me. So I think more organizations need to be willing to work with mothers, willing to work with other parts of the family. However, doing it in a way that's not exploitative, and we don't start doing this lived experience thing and using their stories as a way, again, to draw down funds or a way to champion your organization because you've worked with this family. It's so difficult, Gina. Like, my heart just is just trying to tell you, my heart wants to tell you two things. Make sure before you want to do anything that you are okay and that you are receiving the support that you need and you deserve. Obviously, nothing will ever take away or replace what you've lost or what you've been impacted by. So, but another thing I think is turn up to the places that they tell you that you shouldn't be, because that's how I started getting my voice heard. And Ben will tell you that. And a few people in this chat will tell you that. The places that they said that Ebby the youth worker should not be, or Ebby the woman, or Ebby the girl from X, Y, and Z should not be, is the places I started to go, because I knew that I could carry the voice of that community that didn't want to speak into a space. And yet, like, I could say so much, but I'm sure people are dropping some stuff down there that you can look at.
It's really important. What I just want to add to that is, hopefully what you can see from what we're trying to do with Power to Fight in this report, there are people and practitioners who get it. So from our perspective, if you look at our advisory, if you go on our website and you see our advisory group, it is made up from such a wide ranging part of the society, whether it's mums or sisters or people who have lost people, to heads of services, to ex-police officers, to people in faith groups, people who work in schools. What I'm trying to say is that like Ebby's saying, there are spaces who understand you. Unfortunately, we don't always, and not just we in terms of my charity, those spaces don't always get the biggest funding or even the biggest promotion. But there are people out there, and please drop us an email. I don't know what part of the country you're in, but it'd be great just to chat outside of this. So please, I'll get Lisa, she can do this, to drop her email privately to you so we can have a conversation. Okay, I'm going to keep going. Geeta, an excellent report. Thank you. There is a lot more to do to stop the negative narrative about young people. What more can we do for structural and a systemic racism scaffolding that prevents children and families from thriving needs to be knocked down? Agreed. Racial trauma is something that needs amplifying. Yep. How do we get into a position where there is an agreed approach across all who work with children and young people? So this again comes back to one of our recommendations, isn't it, really, about this collaborative conversation. And many moons ago, when I used to work for a local authority, I had this weird title, Gangs and Serious Youth Violence Coordinator, which basically meant that I had the opportunity of creating a strategy for a London borough around youth violence. Now, what that did mean is that I was in a position to bring different people together at different times and bring a collaborative approach. But I don't know if that is something which we see. I think what you got with the public health approach and the VRU is at least an attempt to do something like that. But I think even with that, it needs to be more nuanced. And I think this conversation about race, anyone who knows me, I've got no problem talking about this stuff. I think the time we're living in right now, if there's ever a moment to talk about this stuff, if there is a moment to look at stuff from a racial lens, through a racial lens, it is now. And I think every organization, whether it's a charity, whether it's a school, whether it's the police, we can get onto that. We need to really have the conversation about what does your organization look like through a racial justice lens. And I think that's the honesty. And like Elaine said, that goes from academia, that goes to charities. I've had the privilege, I think it's a privilege, over the last 6 months or 3 or 4 months to deliver diversity and inclusion training into multiple organizations. And I think what I'm learning is that these organizations just have no idea how to have that conversation, Geeta, around race. So I think that really needs to happen. I'm going to just keep going. What are the next steps for this report? Do you intend to pilot this? 100% we intend to pilot it if nice people give us some money. So there you go. There's a challenge to any funders who might be listening to this. We have the model, we've done the research, we've got the people, and we'd love to pilot it. And there are hopefully some plans in place, but we'd like to do that. Anonymous attendee, to add to the idea that Black and brown young people are often not meeting criteria for CAMS, what did the panel think about the idea that these systems criteria for risk and referral are based on white European constructions of distress and its expression? How can we combat this systemically within the CAMS and the NHS? Dr. Zayana, over to you.
That is such a good question, and I think there'll be many answers to it, but I think to start with, it's just acknowledging, I think going on from what Ben was saying about taking an anti-racist stance generally within the NHS and thinking about who we're offering what service to, and if we're not reaching people that we should be, why aren't we? And these questions are being asked within CAM services, and we are thinking about how to engage Black and minority ethnic young people and why we're not. I think it's shocking that it's such an early stage that these conversations are going on. It should have happened many, many years ago. And I think just to give you some hope, there are practitioners like myself who are championing families and people and young people and trying to get these kind of changes considered and thought about. But it is an ongoing kind of, it'll be an ongoing conversation as to how we do challenge, as you're saying, kind of what the criteria are, and about risk in particular, how young Black men are viewed, going on from what Ebby and Claude were saying, the idea of what violence is and where it comes from. There's so many kind of layers that have to be challenged and considered. And I think just to start having these conversations openly like we are is a really good position. But yeah, I think it's important for everybody within the systems to challenge these ideas and to kind of share new ways of thinking and to look at who's being referred, why aren't certain groups being referred, who are we, look at our communities, what's our referral pathways, all the kind of things that have come out. If you actually look at the ethnicity of people being referred and then you look at your service, look at where you are. If you're in Camberwell, for example, do you represent your community? And it's having audits and going back to that, service evaluation type stuff, but it does actually really help to then say to service providers, you're not meeting the criteria for these young people. You should be offering this service. What are you doing about it?
Absolutely. Thank you so much. Andre, again, this one's definitely going to live. Can we explore the redirecting of some of the money seized from crime by the Met to help bereaved families with funeral costs and therapy? We need Sophie Linden on this one as well. I hope maybe she's on the line, who knows? But Lib, any thoughts on this brilliant idea from Andre?
I think it's a really, really good idea. I don't know that that's necessarily the key route that we could do it by, but I think what we're talking about all of the time is how do we make better use of the resources we've got, which will be a real focus for us as we come out of COVID, and resources are going to be scarce. And I think what we're hearing today in very many different ways to many different challenges to parts of the system is, that's not being done at the moment quite as effectively as it needs to be. It's not reaching necessarily the right people. It's not being delivered in the right way. And certainly I've heard the challenge to myself in the organisation that I'm in around, you know, what is your definition around violence? You know, are you looking at, you know, as Ebby was saying, you know, how much are you looking at mothers? How much are you looking at the family relationships? And, you know, how advanced is that work? And I think that's absolutely key. I mean, having, you know, met myself, you know, mothers who've lost kids, and being a mother myself, I just, you know, I'm always utterly amazed by the strength of character that I've just, you know, seen exhibited by, you know, people who I just couldn't imagine. I couldn't imagine having myself, I must admit, and the glue that knits so many of the grassroots community, neighbourhood responses, some of which are sort of pushed through an organisation and some of which are completely, you know, completely not. And I think that's really important for us to be absolutely important part of our approach. Certainly the whole family approach is absolutely key as well. But I mean, there is more of a challenge, getting back to some of the money questions, around how we as a unit make sure that the resources that we've got, which are nowhere near as extensive as some of the proceeds of crime might be, but nonetheless, are we using them in the most appropriate way? And I think we're very conscious of that, and that needs to be, you know, needs to be constantly challenged, because, you know, that's something we need to learn from. So in terms of, it's a very long way round of answering Andre's original question, which I can't answer because I'm not in a position of power to be able to do that. But I do think we've got you know, there is a big systems challenge for us about making sure resources are better spent. Last year, I think we spent the cost of violence just from a financial perspective, and of course we're talking about so much more than a financial perspective here. I think we estimated in our report was £3 billion. I mean, just think what you could do with a sort of fraction of that in terms of prevention.
Really helpful. We're running out of time, and there's lots of questions here. But let me just try and go through it. I know you engaged with the London VRU. Have you engaged with other VRUs and HO on implementing your model nationally? I don't, anywhere outside of Watford, I get a nosebleed, so no, that hasn't happened yet. But hopefully that will happen. But I mean, at the moment, this is a very London-centric report. And I think our dream would be that if we can prove that this model can work in a couple of boroughs, and then that can be replicated, then that's a touch. So it's not that I'm not interested in going nationally. I just think I'm a bit nervous about upscaling quickly. So I think, you know, if we can focus locally, that'd be locally to us, that'd be good. Okay, such needed report. Thank you. To put evidence to what's needed, how can youth workers who go into schools begin to encourage those changes within schools? Senior management never listen to youth workers' recommendations, even though we're invited to help with those specific young people, but especially with racism and sexism within schools. Like, who do we go to? How to hold them to account without losing that relationship with young people by them stopping projects? Claude, do you want to comment on that one?
I think that might be one for Ebby, you know.
Elaine, come on, Elaine.
No, I think it's a really interesting question. I was going to pair it up with another question there to save time. There's one that says, how can we address the microaggressions within the sector? Yeah. And I think these two go hand in hand, really. And I think one of the interesting thing when I was writing up about cultural competency is there's a huge amount of literature on how to have sort of pragmatic models of implementing cultural competency in work settings, but it's all really American based. It's all really US literature. And I really struggle to find UK-based authors that were writing about models of cultural competency which would answer these questions, which would think about how could you implement counteracting microaggressions in classrooms, in school settings. And I think actually that's something that could come out of this, is that there is a real gap in authorship and research in the UK context. We have a really specific context, you know, just to think about London and you know, not even to think nationally, but we have very localized communities and experiences in London and this could be a really interesting project to move forward with, to think about how could we make a kind of model for teaching cultural competency, a model of implementing cultural competency in institutional spaces that currently doesn't really exist in the UK context. So I think that's a really good question and could be moved forward with off the back of this.
Yeah, that's really helpful. Ebby, I saw your chat, go for it.
There's about the question.
Yeah, go on.
Yeah, Lawrence, you asked a very, very, very important question about what are the panel's thoughts on the adultification of Black girls and whether this contributes to Black girls being traumatized and overlooked in therapeutic services. That's the reason I started Milk and Honey. I started it because of, without even the term adultification. So I think that this term is becoming a buzzword in London. It has come from the US, from like a lot of research, especially from Georgetown University. Now, for me, how we look at Black girls in the UK, full stop, is important, and how they're not seen and they're not heard, and we don't see them in our systems. And it is one of the recommendations. Without the racial aspect, we speak about better work with girls. But what I'm saying is we need to do better work with Black girls, because they are also part of the community and they are the people in the community that hold things together. I think that the adultification of our Black girls is not just what contributes to them being traumatized and overlooked in therapeutic services, but being adultified and overlooked in the education system, and being adultified and overlooked in the mental health system as well. And the way that all of these services look at them, which means that they don't get the support, which means that people make great assumptions. But wait me, I'm about to do that research.
Okay, thank you. We're coming into land. It's a really good question. Hi. Interesting that GPs are not specifically present in one of the services mentioned. It feels that there is an opportunity for GPs to recognize their connection power, sometimes knowing the family and context. How can GPs be empowered to enhance their advocacy power? I'm going to bring in Ziana, but just to let you know, we are often, Powder Fight are often contacted by GPs. And it's one of these times when I normally got an answer for most things, but when it comes to GPs, it's kind of, I feel like it's a bit more complicated. But I do feel that GPs, like any other institution that we're dealing with, need the training we're talking about, need the support we're talking about. I don't think they should be excluded from with this cultural competency conversation. And you know, there's many examples I've had where I've spoken to GPs and I'm just like, that's just the culture of the person you're dealing with. And that's the reason why, you know, if we're talking about getting tested for STDs or whatever it is, there is some cultural stuff which you might just need to unpack why some people are not coming forward. Some of it is just, you know, it's not always cultural, but there's some things there which I've had conversations with GPs. So I think they need to train in like anybody else. But Zayana, in your experience, how do we link GPs more into the conversation?
I think it's such an important question. And I think it's, as you say, something that does get overlooked. I think it's about, again, going back to the network of how we speak to each other, who we include in letters and conversations, and asking families who's important to you, and asking the young person, do you ever speak to your GP? And I think there's something about making sure that we check it's okay to share those details, but also allowing, there has to be a conversation about what GPs know about that family or young person, and whether, yes, I think it'd be really helpful to include all different kind of disciplines, but it's also an individual kind of assessment in terms of who you're working with. I think it's difficult to make kind of blanket decisions about people, because you have to meet them and, you know, have a sense of what they need. But I do also think there is, since GPs have started commissioning and the pressures they're under and the amount of time they have to see people and actually get a feel for families, can really affect how much they're involved. And I suppose it's just being aware of the different pressures on different services. And I think it's definitely something for us to think about, how we can include GPs more and what do we need to do to include them in our networks and thinking. But yeah, definitely training. I think there is something to be said for how GPs, especially in my experience of mental health, I've done a lot of training with GPs, helping them think about what that means and what it looks like, because they see so many people and they don't have long to kind of make their decisions. And it's a, you know, it's a can of worms sometimes.
Really helpful. And then the last question, and before we'll do, we'll just have closing comments, and then hopefully we can, like Josh has done this incredible representation of this of our conversation, which we can have a look at. But Becca, I wondered what you thought about the role of peer support and the conduit to service approach for female family members. Again, I'm sure Ebby could say something. She's disappeared though. So I might hand over to Elaine on this one, actually. Just if you've got any thoughts on this. You're muted, my friend.
Who, me or Elaine?
Elaine was
Go to Ebby. This is.
I don't know if you can comment on Becca's question, if you can see it.
I can't see it.
So I'll read it to you. I wondered what you thought about the role of peer support and the conduit to services approach for female family members. I suppose we've answered that a little bit, but I mean, does it need to be more nuanced and more specific?
I think answering these questions scare me a bit, because I feel like what happens is indirectly my brain is being picked, and then I'm going to see a project that is going to do exactly what I just said, which hasn't actually consulted the girls. So my thing is, like, I hear your question. No, I'm going to answer it, but this is kind of the problem that we have when we're working with girls. Do you understand what I mean? When we're working with boys, nobody asks these questions because it's kind of seen as easy to do. Do you understand what I mean? So I think the role of peer support with girls is very important, but you can't do it without being able to engage the girls. And if you're not, and it's not just surface level engagement, it has to be deep rooted engagement. And I know there's one person on here that's gonna love that I say this, but you have to do the work on yourself. If you are a woman working with girls, you have to do the work on yourself, and that is the best place to start, because you can't do peer support with young girls who are going to be talking about issues that you as a woman could like have been through or could potentially go through. I think with men in this work, it's easier for them to dissociate their emotions at times for how close the experience might be from like a male to another male. But when it's a woman, it's so deep rooted and emotional that if you're not working on yourself, you can't offer anything to the girls. If you're not asking girls, you can't offer anything. And quite frankly, it goes back to Lawrence's question of what girls are you talking about? What girls in the community are you talking about? What girls in the schools are you talking about? Are you talking about the ones that are easy to engage, or are you talking about the ones that are not going to speak to you? Are you talking about the sisters who have just lost their brothers, or are you talking about the girlfriends of the boys? So I think, you know, labeling it with peer support is all well and good, but who are you talking about when we're talking about girls? And I think this work around violence and around girls, we do some amazing work with girls who are exploited, like I've said, but we miss the bar for girls who are deemed as hard to reach, deemed as aggressive, because guaranteed a lot of people don't know where they are. So how can you engage with a family member that's a girl or a woman who has experienced these things if you don't know her experience? And you can't know her experience if you've never tried to engage with them, if that makes sense.
Yeah, really, really helpful. And we only got a few minutes left, but one of the questions which came in was particularly around faith groups. I think, again, I put faith groups in the same category as any other institution. The pastors and the youth workers in those groups need clinical supervision. They need to be trained contextually about the communities that they're serving. They need to make sure the safeguarding is correct. But I think where churches and faith groups are uniquely placed is that they do have the ability to release funds and buildings. I know we're in this kind of COVID time where the building thing is complicated, but in normal times, you've got volunteers, resources, and buildings which should be accessible. But at the same time, and this is the question I would always say to faith groups, are you culturally competent? Do you understand your context? How do your sermons, how do the people in your team, in your leadership teams represent the community around you? It's no different to any other institution. And those are the questions which I know the church are having in particular are having a massive conversation about. So, and I know there's a lot of churches on this chat. There's a lot of churches and faith groups that we have trained. And I think the penny's beginning to drop, but we can always do more. So let's round up. And I think I just want to thank you guys. I want to thank everybody who's participated tonight and who's listened. I just want to thank our panelists, and everybody on this panel has been involved in the report in some shape or form. personally, I really want us to now step into the doing aspect of it. I'm not one for the too much talk. I'm a bit more action. So now we've proven what needs to happen. We've got some really good kind of ideas, but now we really want to get into the piloting. So that is my discreet or not so discreet arts of the VRU, and also to any other funders out there. Can we actually sit down and now work out how this plays out for our communities? But very quickly, in a sentence, we're going to go around a sentence, final words. So Ziana, anything you'd like to say?
Oh, a sentence, that's really hard.
Yeah, I know.
I think just, yeah, thank you to the amazing team. And also, I think all the questions today have been so interesting and thoughtful. I really hope these conversations continue, and that this, as Ben was saying, this is the beginning of something. This is definitely something to build on and think about. And it's something is close to all of our heart and we're very passionate about. So I really hope that, yeah, that comes across, and that this is something that is part of our value system and our ethos. It's not just a report that we've written. It's something that we all are very connected to. So just to say that.
Thank you. Claude?
And the sentence is really short, but I'll keep it brief. I think if you've got any organizations that are in here, people in senior positions, I think it's really about auditing your organization and doing and really checking how culturally competent are you. And secondly, you know, what are you going to do about making any changes? And then lastly, to all of the practitioners on the front line, if you are not getting any clinical supervision tomorrow, go to your line managers, to your managers, make up noise, and your well-being is paramount and important. So please, we can't do this work without you. So knock on the doors tomorrow.
Long sentence, but I value everything you just said there. So it's good. Ebenita.
Yeah, I just want to say thank you to the wonderful team that I worked with for allowing me to come with my vim, and everybody that was in the chat. I think I'm going to keep it short and sweet for once. If you are in here and you are a CEO, a funder, a person with whatever kind of power, if you are going to take on these recommendations, make sure you appreciate where they have come from. Do not just take these recommendations and run with them. I don't want to see no shiny reports. I don't want to see no child bereavement services created. I just don't want to see things that are created without the community and without the ethos of being grassroots. If you are going to work with grassroots organizations, may we not be your add-on. We are more than just an add-on. And I'm going to keep saying it, pay your frontline staff. And like Claude said, if you are a frontline practitioner and you do not get no form of supervision, make some noise, resist the systems. Basically, this is it. Resist the systems that have told you that you cannot resist them, and you will surely get everything that it is that you deserve.
100% agree with that one. Elaine.
Oh, so many things to say, but I would just say, obviously, thank you to the team. It's been an absolute privilege to work with you all, and the participants. Every single one of them made this report what it was, and it's great to see so many people in the chat, and I've been reading through your comments, and it's great. Thanks to everyone for coming tonight. And 2020 has been a mad one. It's been a very difficult year for us, but I think there is an opportunity now to kind of have a restart, if you like. We've got this, we've had a language for a while that's challenged assumptions about violence and how we respond to violence, and now there is evidence to support a different pragmatic way of approaching it. And so let this be a turning point then to have a paradigm shift, to have a different way of thinking about it, a different way of doing this, so that we can actually provide the services that we need to.
Fantastic. And then last but not least, Lib Peck, any final comments?
Yeah, great. Thank you. Keep them brief as well. I mean, thanks very much. I think it's been an excellent session, and I think it's been an excellent report. I think that what makes it a really good report is the voices of community come shining through. And I think I take the point that, you know, any system has got to be utilising, working with, listening to, responding to, putting at the heart of, you know, how you construct something different. And then finally, I think it's got to be about action. and agree with you, Ben. And I loved one of your opening comments, Zayana, which was around, hopeful to make a difference. And that's how I've left, I suppose, today's session, because I think we can make a difference if we work collectively using the different powers, the different influences and the different resources we've all got within our capability. Yeah, thanks very much indeed. Great.
Excellent. I think that's a good place to stop, just in terms of being hopeful. I hope this report has allowed people to be hopeful. Like Elaine said, this has been a difficult year for everyone, and to be able to present something which hopefully brings some positivity, but some real kind of thinking about how we can move forward with this particular issue of violence which impacts and affects young people, is massive. So take the report. I do want you to take it, digest it, think about it. I think Ebby's got a really good point. It's never about a drag and drop or copy and paste, but the report is out in the public domain for you to be challenged about your practice, and that's what we want. So yeah, take it and do what you need to do with it. But I think Ebby's made some really good points. Finally, I'm just going to look at what Josh has done, and let's just give Josh a virtual clap, because this guy's put something quite incredible together. So I don't know if I can. Is there any way I can make this?
Can you share it, Ben?
Well, I'm gonna hold on. There we go. Can everybody see that bigger now? Is that just me, or I'm?
Wow, no,
I can see it. Can see it.
It's great.
Okay. Is that
wow.
big? Is that big for everyone? Yeah.
That's brilliant.
Yeah,
it's amazing.
So this is amazing, and I just think, we'll definitely get a copy of this, and I'll be able to share it around, and we'll put it on our social media. But this is effectively what we've been talking about today, and man, wow. You're looking at the stuff around community.
Amazing.
Oh man, this is brilliant. And I know there's people on this call who learn like this, who really understand it. So this is fantastic. We'll get this out to people. It'll be on our social media. I'm going to get this framed probably for the office.
It's amazing.
But it's really good. And I think you can see, we're talking about violence reduction and the gap and therapeutic services. How do you make therapy more accessible? I love it. This is great. So hopefully this, maybe those are a bit more visual. This really helps it. I just want to thank Josh for that. We've run over, which isn't a surprise, but I just want to say thank you so much to everybody who's engaged tonight. I'm just going to share the screen very quickly. Hold on a minute. Let's see if I can do this. There you go. Get in contact with us if you've got any questions. And if you get in contact with us, I can send you email addresses of everybody. If there's particular people you want to get engaged with, I'm just saying that without even talking to them about it. It'll be fine. Yeah. I'll give them the personal phone numbers, everything, it'll be fine. But it's just that contact details. And we are a charity. So my trustees are in my ear saying, you can donate to us. I can legitimately ask some money from you guys. So, we are a charity to go to donate. And there's plenty of ways you can do that. You can even do it right now via mobile phone. But yeah, thank you so much for just your time, your energy. This will be on YouTube tonight. So anybody who did not see this, you can send it to your people and you can have a really big conversation. So thank you very much for everybody. Before I close, let me just see if there's everyone's saying thank you in the chat. Yeah, thank you, incredible work. Excellent session. I'm hoping that if there's been any requests, Lisa would have picked some stuff up. Wow, somebody works in Blackburn in Northern England. Sounds cold, but I'm sure it's okay, which is a very different context to London. But this has opened up so many valuable, relatable and much needed discussions. Ebby, especially your voice as a practitioner and females provide so much thinking for me and my service. Thank you for providing this space. I have so much to take away, reflect on, and action. I will be asking and advocating for clinical supervision. Yes, for myself and for my colleagues tomorrow. Yeah, just say power to fight, and the team said it. And I won't argue.
And we mean it.
We mean it. Change and challenge is needed. Thank you so much. Excellent work. Yeah, brilliant. So we're going to end it there. Thank you so much. You've all been amazing. This will be on YouTube in a bit. Take care, everybody.
Love. Bye. Bye, everyone.
Nice one.
Bye.
Thank you.
Bye-bye. Bye-bye. Nice one.